see you all here. Welcome to our quarterly Q&A. I'm delighted with the large attendance. I know I have some questions already, which we will get to in the Q&A. Some of you have not been here before. I'm happy that you're here. What we tend to do with these sessions is to provide a couple of important informational updates, which we're going to do in the first 25-30 minutes. Then we'll have time for Q&A. Then we also have a special presentation related to an activity that occurred on campus about a month ago. Look, let me get the elephant in the room out of the way, and because I know what's on your mind, as at least as it relates to me, and you're going to be frustrated. I cannot add anything to what I shared with the campus several weeks ago in my bittersweet announcement, and it is bittersweet for me, namely that I was going to transition from presidency here to being the chancellor for the university system. Well, thank you. It's as I wrote, it's a humbling privilege for me. Some of you may wonder, what's wrong with that guy? I'm a physician. I've never pretended to be a guru, particularly in areas of undergraduate education, which is so much of what 176,000 students in the university system, in the 12 institutions and 3 institutions of higher ed, focus on. But I've learned over the years, and I do think many of you know that I have a passion for education. I was sharing with the Diversity Advisory Council this morning that when people have asked me along the way what I was going to do after my presidency, I sort of reflexly said, I want to make sure I do something in the remainder of my career that increases the access for many who do not have sufficient access now to getting an education, to having the privilege I had and all of you in this room have to get an education. And that includes children, particularly children whose families are poor, but it also includes adults who started their education, never finished it, and needed to have a better life. So that's what I was going to do. And to be handed an official platform to make the difference, would any of you do something different? You wouldn't, you shouldn't. And that's why I made this decision. As one of the law school professors said, in reminding me, and in turn letting me remind you, that I'm not leaving the company. I'm not leaving the organization. I'm not going to California or Texas. The way he described it, this is Mark Graber, one of our law professors, he said, you're just going one flight up. So that's the way I'd like you to think about it. Just going one flight up, and I'll be around to keep an eye on things. But why did I say I was going to frustrate you? Some of you appropriately would ask the question, okay, got it. When is this going to happen? And who's going to be the interim? And I'll look you all straight in the face and say, I can't tell you. But I think the announcement is coming tomorrow. And I'm not playing games with you. It's not my announcement to make. It's the announcement of the regents and the chancellor. And as things are planned now, they will make that announcement tomorrow. So watch your mail. Hate me for the fact that I'm acting like this, but that's the way it's got to be. We've got to be respectful of these things. So with that, let's get into some material matters. As I said, we have some presentations that you need to know about, and then I'll take some questions. Some of them have been submitted to me as written questions, and I'll do the best I can with those, and we'll certainly take questions from the floor. So let me make a proper announcement of what we're going to hear about next, because it's important in terms of how we work here. In September, Cary's Law Center for Dispute Resolution launched an important service that frankly deals with us being able to get along with each other. It's the Workplace Mediation Service, and it's a free university-wide program that's open to all faculty, staff, and student employees who are experiencing workplace conflict and want to work it out. Initiate mediation rather than doing what's available to you, which is a formal review through Human Services. It's a way of getting everybody to the table to talk it out. There's a lot of expertise in this area in the School of Law, and we are offering it campus-wide. I think it's important. I'd like to pretend that we all get along perfectly with each other, but we're not perfect. And this is a way to get us a little bit closer. So let me introduce Aisha Samples, who manages the service and is going to tell us a little bit about it and answer your questions. Aisha.
Thank you very much, Dr. Perman, for that great introduction. Good morning, everyone. I'm here to tell you about two great resources that are available at the university. The first is the Center for Dispute Resolution, which is also known as CDRUM. It is, as Dr. Perman said, housed in the law school. And CDRUM provides professional services and training in conflict management. Last year, with Dr. Ward's leadership, the university asked CDRUM to develop a workplace mediation program for UMB employees. And so in September, CDRUM launched the Workplace Mediation Service. And it's a resource for employees who are experiencing conflict at work and who also want to resolve or address that conflict in a collaborative setting. In my presentation this morning, I'm going to share with you what mediation looks like through the mediation service, how you can access us, and also answer questions that you have if there's time after I talk. At some point in your time at the university, you may or a coworker may be asked to participate in a mediation, or you may want to request a mediation. And so we want you to know about the Workplace Mediation Service, feel confident in using the service, and also support employees who want to use mediation. Raise your hand if you know someone who has used or who has thought about using mediation. Thank you. The common denominator there is the word mediation. The fact is that mediation looks different depending on the setting, who designed it, and who's running it. So out of all the hands there are probably very important distinctions between those mediation services that were used or considered. So it's important that employees understand what mediation looks like through the Workplace Mediation Service. We want you to think about it as a conversation. A private conversation that involves a neutral third party. Employees sometimes experience conflict at work, or you may have concerns about what's happening in the workplace. And so mediation is a forum for you to discuss those concerns with the other person or people who are involved, and also an opportunity to develop a plan going forward. The mediator helps the individuals have a conversation and also facilitates the mediation process. Mediation may result in an agreement. It may result in a better understanding about the situation, or both. The Workplace Mediation Service was designed over several months in collaboration with several offices at the university. The Office of Accountability and Compliance, Human Resource Services, Office of the Ombuds, and the University Council. And I share that so that you know that it was not designed in a silo. It was designed in consideration of the other conflict management options that are available at the university. And those offices that I mentioned are our referral partners. So we do accept referrals from those offices. And it's also important to know that the Workplace Mediation Service is separate from all of those offices. Workplace Mediation Service, as Dr. Perman mentioned, is available for all employees. So that's staff, faculty, and student employees. We serve all of the schools and the administration. And it can be used as a standalone resource and is also available as a resource to supplement other conflict management options that are being used. Our goals for employees who use the Workplace Mediation Service are based on mediation standards, mediation law, and our experience as mediators. And the mediators who you will be using and who provide the service are C-Drum mediators. We have a staff of 5 trained and experienced mediators. One goal is for employees to maximize their engagement and satisfaction in the process and the outcomes. And in order to do that, in order to achieve that, it's important that the participation be voluntary and that the service is free. So employees may opt into using mediation, and at any time in the process, they may opt out of using mediation and do not have to provide a reason. Also, you don't have to worry about paying for it from your department or as an individual because the university has invested in the Workplace Mediation Service. A second goal is for employees to develop outcomes that meet their needs and also that they are satisfied with. And in order to do that, employees need to feel treated fairly in the process. And so we provide, with our mediators, an impartial process. And what does that mean? That means we don't take sides. We also do not provide advice, suggestions, and we don't tell people what they should do or what they need to do to resolve the issues. We depend on the people who are experiencing the workplace issues to resolve it themselves. Our mediators also do not judge individuals or the situations that they bring to mediation or how they responded to a situation. And the third goal is for employees to feel comfortable with sharing their experiences and their perspectives with us and understand that the workplace mediation will keep their information private. So our mediators follow Maryland confidentiality law regarding mediation. So the big things to understand out of that, there are 4. Participation is voluntary, it's free, and the process is impartial and confidential. I want to talk a little bit about what's appropriate and not appropriate for mediation. So, and I'll talk about it in terms of issues, configurations, relationships, and feelings and emotions. The issues that are appropriate for mediation are whatever workplace issues that you or a coworker are experiencing, with 4 exceptions. That's sexual misconduct, discrimination, family leave, and medical issues. And the appropriate offices for those are sexual misconduct and discrimination. It's appropriate for the Office of Accountability and Compliance. If there are issues that involve family leave or medical issues, the appropriate office is Human Resource Services. So we have a screening process, and in that process, we get cases that involve sexual misconduct or discrimination. We'll provide information to the individual about the Office of Accountability and Compliance, and also for family leave and medical issues, we'll provide information about the Human Resource Services. As far as configurations, people do not need to be in the same office. They can be in different departments. They can be in different schools. They can be administration and in another school. We're here to support a variety of configurations of where people are. And in terms of relationships, we assist coworkers, team members, committee members, client service providers, and also supervisors and direct reports. And people come to mediation with a variety of feelings based on how they've been impacted by the workplace issues. So one individual could come to mediation and express in the same session that they felt overwhelmed, stressed, appreciated, unappreciated, they felt welcomed, they felt ignored. So we are designed to, we're here for a variety of issues with those 4 exceptions, a variety of configurations, relationships, and feelings and emotions. What I appreciate the most about mediation is are the long-term benefits. And so some of those long-term benefits are satisfaction with the mediation process and long-term satisfaction with the outcomes. And sometimes the outcome is an agreement, as I mentioned earlier, and sometimes it's a better understanding of the situation and a better understanding of everyone who's at the mediation table. Another benefit of using mediation is that it can be used to help prevent small problems from getting big. It can also be used to help big problems from getting bigger. And the benefits of mediation have been realized by employees at other USM institutions. So Frostburg State University, University of Maryland Global Campus, University of Maryland Baltimore County, and Towson University all have workplace mediation services available to their employees. To access us, there's information on our flyer, and there's some down here at the table, and our contact information is at the bottom of the screen. So we are available by phone, in person, and by email, and we also have information on our website. And if you would like to come by our office and visit us, please do. We are again located in the law school, Suite 411. Once we receive a referral, we take it from there, and we contact the individual who requested mediation. And the important thing to know out of that process is we realize that sometimes people may feel nervous about moving on to the next step, which is having the other people contacted. So maybe they may have want to use mediation with their supervisor or with someone they have a tense relationship with. So we only proceed to the next step after discussing with the individual how they would like us to proceed, and we come to an agreement about how to approach the supervisor or the other people about mediation. Our current roster of mediators, again, are the CDRUM staff members, and our goal is to have a training this summer, a mediation training, so that we have representatives of mediators from various parts of the university. So we will open up the training for people who want to volunteer, mediate through the Workplace Mediation Service, and that'll be for you and the employees. And you'll hear more information about that later. What we're asking from you is to use us when you need us, share information about us, and contact us if you have questions or need more information. And tomorrow, if you go to the Holiday Craft Fair, please stop by our table. We'll be located in the lobby, and we'll be there with information and available to answer any questions.
Thank you, Ms. Samples. We have time for one or two questions, if there are. Okay, thank you.
And I'll be here at the end, so if you have questions for me.
Thank you, Aisha. So next up, an important report as well. Our Chief Human Resources Officer, Matt Lasecki. He's going to share with you in a summary fashion the campus climate survey, which was administered to faculty and staff this past March. And I'll just recall for you that this is a follow-up survey to one that we did in 2016. We used that as a baseline. We wanted to see not whether we've arrived and cured everything, but at least whether we've made progress. Using the data, are we growing? So we use the same metrics this year. I think we added a few questions, so those then become baseline. And let's hear what we found.
Thank you, President Perman. Those were all of my slides. Thank you. Let me fast forward here a little bit. So let me take you on a little bit of a journey here through time. First off, as President Perman said, in this past spring, we completed our second ever university-wide climate and engagement survey. I know in the past that different parts of our organization have done surveys within their particular areas, but this was the second time that we had ever done this organization-wide. Going back to 2015, there was a lot of unrest. We had just experienced the death of Freddie Gray, and there were a lot of very difficult conversations going on within the local community and within our university as well. Part of that triggered an idea that we should conduct a climate survey, a culture survey, to understand what was going on within our university and how people staff, faculty, and students were perceiving that climate and that culture. So we created a new university feedback system that was intended to work alongside our existing feedback systems. This would be another example. The Q&As have been going on for a time. We have discussion groups. There's the Diversity Advisory Council. So there are lots of other forums that were focused on having discussions. But what we did not have is something that looked at the university as a whole. Excuse me. Our goals with the 2016 survey were to create a baseline. It was also to create useful information that we could take, identify opportunities, and then help to develop programs that would help move the ball where we had those opportunities. We took a look at a couple of vendors out there and settled with Gallup. Gallup is a worldwide recognized expert in employee engagement and survey methodology. Their database that we can benchmark against has millions and millions of responses worldwide. So we gained a depth that we could actually compare our university to other industries and in some cases other universities as well. So in 2019, we completed our survey between February and March. We had 3,000, a little over 3,000 individuals. I think the actual number is 3,028 people complete the survey, which is about 44% of our entire population. Now in 2019, students completed a different survey. So 3,028 were actually the number of faculty and staff that completed the survey. So a very nice sample. Today, we're going to focus on some of the results at the university level and not get down to the school and administrative department level. I would also put a disclaimer out there for all of the researchers in the room that this is not a research study. We'll use words like meaningful as opposed to significance. Meaningful is a term that Gallup uses based upon their large database of scores. Based upon a sample size, they can determine whether movement is meaningful. But I don't want to imply that that is significant. That's a whole different realm. And then just as a quick note that because we wanted to ensure people anonymity and the security of their responses, we set a standard that if there were no more than 5, or if there were less than 5 responses in any particular item, we would not see those results and they would be rolled up to the next highest level. The survey instrument itself, and this is consistent from both 16 and 19, was a 5-point Likert scale. In general, for the majority of the questions, 1 was low agreement, 5 was high agreement. There are, I think, 3 or 4 inverted questions. There were a total of 53 that covered such topics as the engagement index, which is the Gallup 12, inclusivity, diversity, organizational work relationships, input on decision-making, organizational values, and campus safety. We also added 6 new questions in 2019, including a couple of questions about gender identity and sexual violence or sexual harassment on campus. Again, we don't have time 1, time 2 on those, but we will be including them in the next round. So in 2016, this is where we scored. If you look at a scale of 1 to 5, 3 being about neutral, you can see that all of our indices were above the neutral point. One of the things that we saw that was very encouraging is organizational values index at 3.83 was our highest index, showing that there is strong identification with our core values at the university. We also saw our diversity index was fairly high at 3.71, and then the engagement index was our 3rd highest. This again is based upon over 3,000 responses and is general across the entire university. This is the result of 2019. Overall, I would say we've made very good progress, meaningful progress, but there is work yet to do. You can see, again, one of our biggest jumps, organizational values. With the work that we've done in publicizing our values and that individual departments have done talking about our organizational values, you can see a pretty meaningful movement there. The engagement index, again, meaningful movement and honors diversity. One of the biggest ones that's important to note is the inclusivity index jumped from 3.36 to 3.54. Again, using the term meaningful, it's a very meaningful improvement overall. And then you can see input into decision making and the safety index are two of the lower ones that are showing us where we have some opportunity to improve. Behind each one of these indexes are somewhere between 3 and 15 different questions that all get aggregated to create the index score. So we do have the ability to drill down to identify in particular specific issues in specific areas of the university, and that gets us to what some of our next steps are. So looking at that data overall, it's good directional information, but it doesn't tell us a lot about where we should be focusing our time and effort in specific areas. This data becomes very useful when you can drill it down to a school level, to an administrative department level, to a particular population within the university, and we do have the ability to do that. In some cases, we've already been communicating that information, and to date, we've spoken with, or had Gallup come in and do a presentation with our senior leadership team. We've shared results with the Diversity Advisory Council, the Staff Senate, the Faculty Senate, and some of the school leadership teams as well in summary format. Our next steps will be, and we have several of these meetings on the calendar as well, going out to the schools and working in depth with their information, sharing it and helping with the analysis. The human resources function within Central Human Resources as well as in the schools, we'll be working together with the schools and administrative leadership to provide support. We've got 35 people that have been through a 2-day Gallup training on how to interpret results and make the best use of those results. So we'll be supporting the efforts at the more local level with knowledge and expertise. The goal is for each of our major units to develop an action plan as well as goals around that action plan, and then to periodically report that information out through internal mechanisms. And then finally, it's not too early for us to begin thinking about the 2021 and 2022 survey. These take a good deal of time to prepare for, and we want to make sure that each time we do this, we're getting better and better at it. So in summary, I want to thank everybody in the room that took the time to participate in the survey. I know a number of people here were on the organizing committee, including the Senate who were involved, other folks from around the room. So thank you for all of your participation. And again, the message is the first survey looked pretty good. We made significant, meaningful movement between 16 and 19, but we definitely have opportunities and we're committed to doing that work. So thank you.
All right, so questions for Mr. Lasecki. This is obviously rolled up, aggregated data. It means the most when it gets down to the schools and the administrative units, and that's where it's going. Anything? All right, so you'll participate, please, in the next survey so we can make sure we're going in the right direction. Again, hardly claiming any victory. Let's open it up to questions. If you don't mind, while you're thinking about questions, I had here a number of questions that were handed to me, and let's address those first. How much money does UMB spend on energy costs? What steps have been taken to reduce these numbers? And are these values published online in an easily accessible location? So I hope you won't be mad at me. I don't have the answers to these questions. But we may be able to get at them. Dawn, do you want to? So our Vice President for Administration and Finance, Dawn Rhodes, can we take a stab? Or we'll get the information?
That's a better answer.
No.
I don't have the answer to those questions either in terms of...
Your microphone.
Green button on your mic. Is that better? Yes. Okay. I don't have the answers to those questions either off the top of my head. Terry Morris is in the room. He may be able to give you an estimate that's closer to actuality, but when we go back to our offices, we can get the information and make sure we give it to the appropriate person. So Terry.
So, Terry, do you want to address anything?
Yeah, I'll do what I can. So I also don't have the specific numbers. But
how about the general question of what we try to do to manage the costs?
Sure, yeah. And we do track the actual cost, so we can certainly provide What we do in terms of increasing our efficiency, we have a couple of groups that focus quite a bit of their energies on looking at what we do in terms of how we generate chill water, how we utilize our steam, how we circulate air, and how we light our buildings. And we're always looking for opportunities to retrofit our systems, replace, say, lighting with LED lighting, which is more energy efficient, therefore costs less to light the same spaces. We're always looking when we're doing system upgrades for opportunities to use more efficient systems. One example would be heat wheels, where instead of just rebuilding or replacing an air handling unit and exhaust system, we see if we can incorporate an energy recovery wheel, it's called a heat wheel, where we can much more efficiently transfer and capture some of the energy that we would normally be exhausting from our buildings. We try to transfer that into the incoming air and thereby reduce our energy costs. We have a central chilled water distribution system that links all of our major research buildings together with a huge chilled water loop where we can more efficiently generate chilled water in a few efficient plants and then send that to all of our buildings instead of having a bunch of distributed plants that only work at part load or part capacity most of the time. So we're always looking at every opportunity to generate chilled water, which cools our buildings, or utilize steam to heat our buildings in the most efficient way possible.
I'll add to that by saying Nazanin Kaladi is our new Associate Vice President for Facilities and Operations. She has done some reorganization, and one thing she has done has been to develop a group that focuses on utilization of utility. As an institution, if we're looking for opportunities to do cost cutting that is less harmful, if we can get smarter about how we use energy, that's a place where we can save money as an institution that will have less negative impact. So there is a focus, and we've assigned ownership of looking at those things to a group within facilities and operations. That did not exist before.
I might take this opportunity, and this is not directly related to cost savings on energy, but it's related to energy. The campus is in the midst of an $80 million project paid for by the state to deal with having adequate power here. Some of you may be familiar with this. How many remember the day before Thanksgiving in 2011? I remember it. Power went out. Some of you might like these events because everybody had to go home. But you know, it's a crisis for a campus like this in many different ways. Apart from the human aspect, there are many scientific experiments and animals to be cared for, and freezers to be kept cold, etc. So for a research-intensive as well as service-intensive campus like this, we can't have that. And as we began looking at it, we realized the obvious. Most of the infrastructure, including the principal pieces of the infrastructure, even at that time were at least 50 years old. And it's not just that things wear out. The bigger problem is that when you have stuff that's 50 years old or more, you can't get the parts anymore. I told that story to the legislature. Some of the people in the legislature, to be very honest with you, were thinking about the idea that we obviously got into this jam because we built big buildings like HSF3 and didn't plan for them, but that's not the point. That wasn't the issue. The issue is an old infrastructure with no parts. And fortunately, we were convincing enough so that the state did indeed fund, and it's a pretty hefty ticket, $80 million over a period of years to replace the electrical infrastructure. And we're on our way to that. Probably another 3-4 years of work, maybe more.
Yeah, at least. Where we are now is the first phase is a new electric service coming from the north, a new substation from BG&E to provide us 100% redundant power to the campus in case we lose service from the south end currently. So that's in place or under construction now, and we're about to go out for bid for the next 2 phases, which include duct bank distribution around campus and the construction of a new substation at the north end of campus.
So hopefully nothing will happen while we prepare for this. The next question I have, I'm not going to read because it's very detailed and appropriately detailed. This is a question about pedestrian safety, and particularly people who are coming from the Otterbein Federal Hill area and streets like Conway, et cetera. Not intersections that are on campus, although we have our issues there. Certainly, I would cite one that's been cited over and over, Martin Luther King in Baltimore, crossing back and forth from the biopark and the neighborhoods to the west. We have those issues. We've tried very hard with the city in terms of lights, in terms of enforcement actions, but there's a lot of detail here which I'm going to give to the appropriate people. I don't know who wrote the question, but I'm going to certainly keep it with me and give it to the appropriate people. The writer, the questioner, mentions being in touch with Eric Costello, who is our councilman, one of our 2 councilmen that represents the area. I know him very well, and we'll see where this is. I'm not going to promise anything because these are the things that unfortunately are not in our direct control. But they are an issue, and I know that a number of our employees have been hit. So it's a totally appropriate issue to raise, and we'll redouble our efforts. Anybody want to comment on this issue? Okay. Now I've got 3 questions, which tells me that there is an issue that's bothering several people that is focused on tuition in the medical school. Now, I could give a seminar, having been a medical school dean, on medical school tuition, but I would tell the rest of you that any kind of professional tuition is no bargain. I would also tell you that, and this is not to plead poor or ask for mercy or anything else, tuition doesn't begin to cover the cost of a professional education. Now, that probably makes some of you mad, because here it's, tuition is way too high across the United States, except for those schools that have been fortunate enough to get massive gifts that have allowed them to offer free tuition. We're not there yet. It's also appropriate, and I'm going to come back to the other piece of this question, these 3 questions, which I think are the real issue here that's bugging some people in a moment. The other appropriate question to ask is, okay, it's very expensive to get a professional education, including in this school in pharmacy. Why is it so expensive? And that's a legitimate question that people should ask. And it becomes, and I'm thinking about my next gig, it becomes something that constantly needs to be addressed and focused on, how we can manage the cost of higher education. But that's not what's bugging people here, if I read these questions correctly. There's a lot here about transparency. And I don't know whether there's anybody here who wants to stand up and talk about this, but that's fine. The transparency, and I think what the transparency is after is how the tuition money is spent. Now, I don't know what the discussions have been in the medical school. I'd be happy anytime to engage that question, because I can look at the folks that are writing this and tell you straight in the face, there's nothing nefarious going on. Nothing nefarious going on in terms of spending tuition. like I said, doesn't begin to cover the costs. But if people feel they're not being communicated properly with, and by the way, I would ask if this has been brought to the USGA, because we do discuss with your student government when we have to increase student fees. Everything with regard to tuition is done in a very public way with the regents. So I'm not trying to be defensive or arguing with anybody, because I'm sure the people who wrote these questions have an issue. And if that issue can be made clear to me, it can be done offline, I'll be able to address it better. Now, open forum. Yes?
Hi there. My name is-
Hi?
Can this hear me from this distance?
Not really.
Okay, I'll try.
Sitting is okay, even though you're being very polite.
So I wrote a couple of those questions, but not all of them.
Thank you. Thank you for standing up.
The USGA is going to have a presentation on this topic on December 11th. There's a petition going around, which I have right here, from the medical school. About a quarter of the students, 154 students in the medical school, have signed it. It sounds like, with respect to communicating to us how price increases work, it seems like the Board of Regents has made mandatory and non-mandatory fees have to go through a committee process, such as the Student Advisory Board. However, the tuitions increases, which we were informed of at a private student leaders meeting, was very opaque. What we're asking for is simply more transparency about where money is going. And this sort of links into the previous question about environmental sustainability. If there are costs that can be cut by lowering our usage, it's possible that some of those costs could go to defer student tuition costs. So I'm hopeful that you'll be able to join us at the USGA meeting on December 11th to hear more students at the medical school talk about this matter, though this assuredly is something that I think is important for all students in the pharmacy school, law school, and elsewhere.
Okay, thank you very much. Others?
Jay, what I can add is the Board of Regents requires that every school that does a tuition increase have a very open
Yes.
conversation with the student body and get their feedback, et cetera, on that. And I know our schools all do that. They do it to different degrees and in different manners.
So if you're complaining about the quality of the communication, which is what I'm taking your comment to be, that's something that we can certainly discuss with medical school leaders. It is something that clearly is concerning to many of you, and we'll address it. Yes, please. Can't hear you.
She knows what she's doing. I was wondering if you know the status of the smoking survey on campus.
Dawn?
Yes. The committee has compiled all of the information from the smoking survey and have pulled out key points and have made recommendations. And they are very close to wrapping that survey up and being able to publish it within, I would say, the next 2 weeks before we leave for the holidays.
Yes, please.
I'd like to know what's the status of campus recycling?
Terry?
That changes quite frequently. So we continue to recycle what we can. We have had to take the shredding operation out of service in preparation for demolition of the building, because that's the site where we're building a new substation. But all other recycling, to my knowledge, is still going on. That's the cans, the bottles, paper, cardboard. So we have not changed or discontinued any of our recycling operations to date. It will become challenging as we get further into this electrical infrastructure project, as we take space away that was dedicated for recycling. We continue to set up temporary facilities where we can to continue recycling as much as we can.
Looking for hands, yes, sir.
Your discussion of the electrical problem makes me think about Baltimore City's problem with the water system, their aging infrastructure. Does that impact the university and what's being done about
How are we doing on water?
That's an increasing problem because of the aging condition of the distribution system. We just had an outage yesterday that impacted one of our buildings. So we continue to work with the city, and what we've been doing recently is identifying opportunities to either make use of existing redundant water service system building or plan to install redundant water services to all of our critical buildings. So again, we're working hand in hand with the city to identify opportunities. Presently, there are buildings that are only served by one service, and when there's a rupture of the very old system in the streets, we do suffer these outages, but we're doing what we can to mitigate that with redundant services, but it's going to take some time.
We established a relationship with DPW about 3 years ago and actually gave them a list of our buildings that had our critical research in it, et cetera, in order to help them as they're developing their plan for campus, if there was any way to expedite the things that would impact those types of buildings that they could incorporate it in their planning. If there is one job that I would not like to have, that is to be in charge of DPW. They have miles and miles of failing infrastructure, and I don't even know how they proactively do it because they're constantly having emergencies pop up that have to redirect dollars that they plan to use in different ways. So as Terry has said, we're continuing to try to talk to them to help them remember that we're here, we're an important part of the community, and please, as you're planning, a factor of what we're doing in. But, I mean, I have to say, Mr. Chow is doing as best as he can. He's got a huge job.
I will just add one thing. We are trying to be as proactive as we can, and just as an example, we have a project now to extend chilled water to the 108 North Green Street Research Building, Biomedical Research Building. And we just kind of at the last minute added a water service from Pearl Street Garage into 108 to give us that redundant water supply for that building. So that's the kind of thing that we're always on the lookout for and doing whatever we can to give us that redundancy.
Looking for hands. Yes, way in the back. Hi.
Hi. I don't know if the park across from the hospital is part of the University of Maryland, but
It is.
Can you enlighten us what's going on?
Yeah, who wants to do that? This is a project. Not that it's an attempted improvement, and we've gotten some funding, correct me if I'm wrong, from the Downtown Partnership, because they care about open spaces downtown. Terry?
Yeah, and there's actually a couple projects underway all at the same time. There's a garage under that park, and
As you well know.
Yeah, and it's older, so it has some issues, and we have a major project underway currently to resurface the base of the park, which is the roof of the garage. So we're doing it in phases, and of course that's going to disturb large sections of that park over the next year or so as we excavate down to the roof, replace the drains, repair leaks, replace piping, etc., and then restore that section and move on to the next section. I think we're doing it in 3 phases. Simultaneous to that, as Dr. Perman said, we're working with the Downtown Partnership to explore ways to enliven that park, and actually Stu would do a better job speaking to that, I think.
It's behind you.
Yeah, thanks, Chair. Can you hear me? So we are working with the Downtown Partnership. We just launched a project to re-envision the park. It's been there as it is now for upwards of 40 years. And I think there's a very common feeling that it's not living up to its full potential in terms of what could be in terms of a very first-class public space. So we're going through a planning process to look at what are the opportunities to open up parts of the park, to make it a place that can be more appealing and used at all hours. And looking at many different ideas, everything ranging from public art to larger lawns, and just ways to make it more of a place that people want to be in. So this process will unfold over the next coming months, and we'll be reaching out to many of the park users and others that interact with the park to get their ideas and thoughts as we come up with this vision. And then also, we'd like to see what's the low-hanging fruit. What can we begin to implement for relatively low cost in the near term, so we can start making a real visual impact on that space. So just really exciting.
Thank you. Being respectful of your time, we have one more agenda item, which is a little piece of fun and fitness. And let me just say, for anybody who's got questions that they want to address to me, I can stay for about 10 minutes afterwards if I've cut anybody off. So in October, there's a group at Human Resources called Launch Your Life. And they kicked off something that I think we did last year as well, the Ultimate Mileage Battle. I hope you get it. The letters spell UMB, if you're paying attention. That group challenged schools to compete against one another for the most steps taken over a month and a half. And there's a prize, traveling trophy, bragging rights, until next year's challenge. I'm happy to say that your old man here took part in the kickoff, walked a mile with everybody, then I got out of there. Stopped counting my steps, so I'm hardly a good example. But to tell us who is and who are the winners, let me ask Jina, Bacchus, and Laurelyn, Irving to come up.
Thank you, Dr. Perman. As he mentioned, the Ultimate Mileage Battle kicked off on October 14th, and we had 776 employees enroll over the 46 days and had a combined total of 230 million steps coming from all 8 cities. Go UNB! And thank you again, Dr. Perman, for your enthusiasm and vigor. You stepped and walked
Keep
very,
talking.
very nicely there. A huge thank you for your support and leadership in that. And definitely with our well-being efforts, and it fosters a healthy culture and work environment here. And if we're healthy, we can excel here at UMB. So I hope everyone got that message. And I'd like to thank some more members of making this event possible. And if you can all stand, please. We'd like to recognize the Fit and Fun group from the School of Nursing. So as Dr. Perman mentioned, so this actually was pioneered by the Fit and Fun group last year, School of Nursing, and they helped pave the way for our successes for this year, which we did for the first time ever all across campus. So thank you so much, Fit and Fun. Next, if you can stand all the wellness champions for the Ultimate Mileage Battle. If you guys all could stand from each of the schools, you know who you are. They helped us with communication. And as they asked everyone to participate, they recruited as many members as possible, and they made this event happen. and also all the walkers and sponsors, everyone that participated in the Ultimate Mileage Battle, please stand. Without you, we couldn't have made this happen. For all your time and resources, thank you so much. And I thought I saw Bill Marker earlier, if you can stand, he's in the back. He is our School of Law alum, and he's the one that named the Ultimate Mileage Battle. He participated in the naming contest. We have a name, so thank you so much. And so I just wanted to thank all the organizers for today's celebration event. Without you, we couldn't have done this. And this is our first Step Challenge celebration, so I hope you'll have some fun.
Good morning. I'm Laurelyn Irving from Diversity and Inclusion in the School of Nursing, and I get to share some fun facts to try and put in perspective all the walking everybody did in here. Jill Sullivan, right here, calculated these. So, just to give you perspective, altogether we walked 3.4 times around the earth, 91,000 miles. Impressive. All right, the graduate school, which is small but mighty, they could have started in Pittsburgh, hiked to Dallas, and then to Seattle, with the mileage that they put in. Here we go. The School of Social Work could have walked from San Diego in the U.S., across the Pacific, across the water, to Kolkata, India.
Meeting the social workers walk on water.
Up there. There we go. The School of Pharmacy could have walked from Paris to Johannesburg, South Africa. School of Medicine, which actually had the most steps and miles, and as a big team, walked 95% around the world. But when you have teams that are different sizes like we had to come up with a way to calculate this that was fair, small versus big teams. So even though they got the most miles, that, I'll give you a hint, didn't put them in first place. Okay, the School of, Campus All-Star. 21,129 miles, could have hiked from Christchurch, New Zealand to Istanbul, Turkey. The School of Nursing, my favorite, hiked 10,050 miles, Melbourne to Reykjavik, and that's a cute little puffin that grows up at Reykjavik. School of Dentistry, Sydney, Australia to Warsaw, Poland.
School of Law.
All right, so I don't want to give that away. But we do hope that if you had a good time this year, that you'll talk this up so that you can encourage other people to join this next year, and that you'll come back and do it again. So Jina will now talk about the specific awards and announce the trophy.
So we had some different categories besides the one that would win the trophy with the most average daily steps, just to encourage everyone to continue to step and to continue in your health journey. So the first category is the most improved category. So we have the top person for the most improved, and then we'll announce that person, and then we'll announce all the teams following suit. So the first person to be announced is Rebecca Greenwald for the top most improved stepper. And Rebecca, Becky is great. She's a trooper because she came back from knee surgery, and as soon as she heard about this category, she went for it and she won. So, congratulations. Okay, Okay, so this is gonna be a bigger group, so if you can come up and receive your gift and line up in a line once I call your names. Great, so for School of Law, we have Gigi, Gehan, Jurgen. School of Medicine, we have Nidhi Rana. School of Nursing, we have Jillian Pahel. School of Social Work, Janice Hicks. School of Pharmacy, Laverne McCoy. School of Dentistry, Sharon Hutchins. And lastly, graduate school, Jessica Grabowski. So congratulations to all the You're welcome. And then for the next category, we're going to talk about the top stepper, the top stepper. And that person is Bill Crockett. And so we heard from a little birdie, he walked 9.9 miles a day, and he's very humble about it. And so total number of steps he walked, 1,260,868 total steps. Is everyone ready for the rest of the group? All right. So, School of Medicine, we have Joanna Koloski. And School of Pharmacy, we have Laverne McCoy again. So Laverne actually won in every category. You're welcome. Next, from the School of Dentistry, we have Carl Oppenheim. School of Social Work, Virginia Matura. I understand she's not here today. So Janet is Next, Graduate School, Sarah Archibald. School of Law, Sarah Jackson. Last but not least, School of Nursing, Amanda Roche. So one more time, let's have an applause for every Now this is the moment we've been waiting for. So the team that had the highest daily step average was the team that would win it all. So for the 6 weeks, this team had the highest daily step average, but we're also going to recognize the runner-ups. So for third place, the School of Law, they came in the third with 8,125 daily average steps. So if you can stand up, as you can see, they're wearing their t-shirts. Thank you for coming down. Congratulations. And the runner-up is the School of Social Work with 8,347 daily average steps. Congratulations. And now, the drum roll. celebrating for the champions for the grand prize traveling trophy. First place goes to the graduate school. So, Flavius, I know you're a representative. And all the graduate school members. So congratulations. Like I said, they had a daily step average of 85.48. And they're very steady with their steps. And I heard they worked really hard to achieve this. So we plan to hold this step challenge annually, and since this is the first one ever, we welcome your feedback so we can always improve it every year. And even though we're graduating in a sense with our accomplishments and this contest, we hope that we could help you in instilling some healthy habits and that we don't stop here with our steps. And now with the new year coming around the corner, we hope that you'll continue in your health journey. And so now we will have cake to celebrate.